Our collective success depends on everyone, government, the private sector, and especially individuals playing their part to move us forward. Today we lay out a roadmap to reopening Massachusetts while we continue to fight COVID-19. These two will be inseparable, getting back to work and fighting COVID until there's a medical breakthrough with treatments or a vaccine. And we cannot move forward unless we commit to continuing to slow the spread. Collectively, we have flattened the curve and avoided the spike in cases that would have broken our healthcare system. But if we don't keep up the fight and don't do the things that we all know we have to do and know we can do, we run the risk of creating a second spike in the fall. We've asked a lot of the people of the Commonwealth since this all began. And thankfully, millions and millions of people have answered the call and played their part. Once again, people need to be vigilant, they need to be careful, and they need to understand the role that they can play themselves as we continue to bring this fight to the virus. It's how we move forward together. Well, first of all, we said from the beginning on this that we were going to follow what I would describe as best practices and data. And the data that we've been able to collect through the work of the Reopening Advisory Board and through the work that's done at the Command Center and the Department of Public Health has been used to incorporate and build this plan. And I think if you also talk to and look at what people in other countries and people in other states are doing with respect to how they're going forward on this stuff and the way they're choosing to measure and monitor what happens as a result of that. These are all elements that we've basically baked into our proposal. And I fully expect that on a go-forward basis, because of the incredible amount of anxiety that comes with both ends of this picture, which is the concern about the public health piece, which we completely understand, and we spend a tremendous amount of time talking about monitoring, and God bless the people of Massachusetts for all they've done to get us to where we are on that one. And on the economic side, there's tremendous anxiety associated with that, and we understand that as well. But the Reopening Advisory Board, which had very smart people on it and met with a zillion different organizations of one kind or another as they went through their process, basically laid out what they felt was a careful and a cautious approach to this. And when we talked about this last week, I said, and Jonathan said, well, what are people going to say when you put this out? And they're going to say, going too fast? We're not going fast enough. And I would just remind everybody that we believe this report, developed by a lot of really bright, smart people who both work in various sectors here in the Commonwealth, live in different regions and operate in different regions of the Commonwealth, have contacts and relationships with people in other states and other countries to help inform our decision-making, along with the very talented and world-class healthcare and public health people we have, developed what they consider to be the balanced approach to this. And the one point I would make to everybody, and I said this 5 times in my opening remarks, the process associated with these phases is a function of how we do. And how we do is a function of how we do with respect to managing the public health issues as we begin this reopening process. People need to understand they need to have a face covering if they can't keep their distance from other people. Keeping distance from other people would be best. Wash hands, hygiene, all that stuff, surfaces, and all the rest. And recognize and understand that we are going to pay attention to that public health data as we move forward. And it's going to be critically important for people to continue to do the things that they've been doing to get us to this point over the course of the past 60 days.